Did you know that a tiny blood clot, no bigger than a grain of rice, can permanently take away your ability to speak, move, or even remember your loved ones? Each year, stroke claims the lives of hundreds of thousands of Americans and remains the leading cause of long-term disability among older adults. But here's the painful truth. Many strokes are preventable if we only recognize the early warning signs in time. It's not always a dramatic fall or slurred speech. Sometimes it's just a strange headache, a brief moment of imbalance, or a flicker of vision loss, and we dismiss it. In today's video, we'll explore the most dangerous types of stroke, how blocked or burst arteries destroy brain cells in minutes, the silent symptoms seniors often overlook, and the most effective prevention strategies backed by leading health institutions like the Mayo Clinic and the American Stroke Association. Because understanding stroke may one day save your life or someone you love. What is a stroke? The core facts you need to know. Think of the brain as the control center of the entire body. It requires a constant supply of oxygen-rich, nutrient-filled blood to function properly. A stroke occurs when the blood supply is suddenly interrupted or significantly reduced to a part of the brain. When blood cannot reach brain tissue, the affected brain cells begin to die within minutes. That's why every second matters during a stroke, and why we often say, time is brain.
Two main types of stroke. There are two main culprits that cause a stroke. Ischemic stroke, due to blockage. This is the most common type, accounting for about 87% of all stroke cases. Imagine it like a plumbing problem. A pipe gets clogged. An ischemic stroke happens when an artery supplying blood to the brain becomes blocked, usually by a blood clot. This clot can form directly within the artery, often due to atherosclerosis, or travel from another part of the body, like the heart. Hemorrhagic stroke, due to bleeding. This type is less common, but can be very serious. Instead of a blockage, a hemorrhagic stroke occurs when a blood vessel in the brain leaks or ruptures. This bleeding can happen within the brain tissue, intracerebral hemorrhage, or in the space surrounding the brain, subarachnoid hemorrhage. The leaked blood puts pressure on brain cells and damages them. Additionally, the area of the brain normally supplied by that blood vessel is now deprived of blood. Before we go any further, I want you to hear this real story. Barbara, age 71, lives in a quiet town in Arizona. She starts every morning the same way, stopping by her local gas station to fill up her car, pick up a copy of USA Today, and head to her favorite corner cafe. She doesn't use smartphones. She prefers the feel of a printed newspaper and face-to-face conversation. But something felt off that morning. As she handed money to the cashier, her wallet slipped from her fingers. When she bent to retrieve it, her right foot trembled slightly. "I must just be tired," she told herself. Minutes later, as she walked into the cafe, the barista smiled and said, "Barbara, is your face a little droopy today?" She laughed. "It's probably just the sunlight playing tricks." But moments later, her vision blurred. A man behind her stepped in quickly. "Ma'am, are you okay? Can you say your name for me?" Barbara tried, but only slurred sounds came out. Luckily, that man remembered a video he'd seen about stroke signs. He called 911 immediately and told others, "Every second counts, act fast." Barbara had suffered an ischemic stroke. A blood clot had blocked a vessel in her brain. But thanks to the quick response, she arrived at the hospital within the golden hour and was given a clot-busting medication, TPA. She regained her ability to speak and move, a miracle made possible by just one person recognizing the signs. Had they waited even an hour, she might never have returned to that cafe again.
Deeper dive, causes and pathology. What's happening inside? Let's take a closer look at what usually causes these blockages or bleeds. Causes of ischemic stroke. Atherosclerosis. This is a gradual process where fatty deposits or plaques build up inside your arteries, causing them to narrow and become less flexible. If a plaque ruptures, a blood clot can form and block the artery. This often occurs in the carotid arteries in the neck, which supply blood to the brain. Embolism, traveling blood clot. A blood clot can form in another part of the body, often the heart, especially in conditions like atrial fibrillation or AFib, where the heart beats irregularly. This clot can break loose, travel through the bloodstream, and get lodged in a smaller brain artery. Other causes: vasculitis, inflammation of blood vessels, or certain blood clotting disorders. Causes of hemorrhagic stroke. Hypertension or high blood pressure. This is a major cause. Chronic high blood pressure weakens artery walls over time, making them more prone to rupture. Brain aneurysms. These are weak, bulging spots on an artery wall. They can develop over time and, if they rupture, cause a subarachnoid hemorrhage. Artery-venous malformations, or AVMs. These are abnormal, tangled connections between arteries and veins in the brain, often present from birth. They have weaker vessel walls and can rupture. Misuse of anticoagulants or blood thinners. Although prescribed to prevent blood clots, in some cases they can increase the risk of bleeding if not carefully managed or if an injury occurs.
Pathology. What happens to brain cells? When blood flow stops, brain cells are deprived of oxygen and glucose. They cannot function and begin to die rapidly. The core. The area of the brain directly affected by the lack of blood flow will suffer irreversible damage quickly. The penumbra. Surrounding this core is an area of brain tissue called the penumbra. The cells here are stunned and at risk, but they can potentially be saved if blood flow is restored quickly enough. This is the target for acute stroke treatments. Recognizing a stroke. Symptoms are crucial. Knowing the signs of a stroke and acting quickly is extremely important. The American Stroke Association encourages the use of the acronym B-FAST. B. Balance. Sudden loss of balance or coordination, dizziness. E. Eyes. Sudden difficulty seeing in one or both eyes, double vision. F. Face drooping. Does one side of the face droop or is it numb? Ask the person to smile. Is their smile uneven? A. Arm weakness. Is one arm or leg weak or numb? Ask them to raise both arms. Does one arm drift downward? S. Speech difficulty. Slurred speech, muttering. Are they unable to speak or hard to understand? Ask them to repeat a simple sentence. T. Time to call 911. Time to call emergency services immediately. If you observe any of these signs, even if they disappear, call emergency services, for example, 911 in the US, or your local emergency number, immediately. Note the time the first symptoms appeared. Other potential hidden symptoms include sudden severe headache with no known cause, especially in hemorrhagic stroke, sudden numbness or weakness, especially on one side of the body, sudden confusion, difficulty understanding speech, sudden difficulty walking. Diagnosis and treatment. Every minute counts. When someone arrives at the hospital with suspected stroke symptoms, rapid assessment. Doctors will quickly assess symptoms and medical history. Brain imaging. A CT scan or MRI of the brain is essential. This helps determine if the stroke is ischemic or hemorrhagic, as treatment methods are very different. Other tests. Blood tests, an electrocardiogram, ECG, to check heart rhythm, and possibly an ultrasound of the carotid arteries or an angiogram to examine blood vessels. Treatment for ischemic stroke. TPA, tissue plasminogen activator. This powerful clot-busting drug can be given intravenously, but must be used within a specific time window, usually 3 to 4.5 hours from symptom onset for many patients. It works by dissolving the blood clot and restoring blood flow.
Mechanical thrombectomy endovascular procedure. For larger blood clots, doctors can perform a procedure where a catheter is threaded through an artery, usually in the groin, up to the brain. Then a stent retriever or suction device is used to physically remove the blood clot. This procedure has a longer time window, up to 24 hours in select patients. Aspirin or antiplatelet drugs. often used to prevent further blood clot formation. Treatment for hemorrhagic stroke. The main goals are to stop the bleeding, reduce pressure on the brain, and prevent complications. Blood pressure control. Medications are often used to lower high blood pressure. Stopping anticoagulants. If the patient is taking anticoagulants, medication may be given to reverse their effects. Surgery. Surgical clip-in. For a ruptured aneurysm, a tiny clamp can be placed at the base of the aneurysm to block blood flow into it. Coiling, or endovascular embolization. Small platinum coils are inserted into the aneurysm via a catheter to fill it and promote clotting, sealing off the aneurysm. Hematoma evacuation, or craniotomy. If there is a large hematoma, blood clot, surgery may be needed to remove it and relieve pressure. Treating AVMs. Options include surgical removal, endovascular embolization, blocking the blood supply, or stereotactic radiosurgery, focused radiation. Prevention, your best defense against stroke. The good news is that up to 80% of strokes can be prevented. Here's how you can reduce your risk. Control high blood pressure. This is the most important controllable risk factor. Work with your doctor to keep your blood pressure at a healthy level. Control cholesterol. High LDL, bad cholesterol, contributes to plaque buildup. Control diabetes. Keep your blood sugar levels well controlled. Eat a healthy diet. Focus on fruits, vegetables, whole grains, lean protein, and healthy fats. Reduce sodium, saturated fats, and trans fats. Maintain a healthy weight. Losing even a small amount of weight if you are overweight can make a big difference. Regular physical activity. Aim for regular, moderate-intensity exercise. Don't smoke. If you smoke, quit. If you don't start. Limit alcohol consumption. Treat atrial fibrillation, or AFib. If you have AFib, your doctor may prescribe anticoagulants to prevent blood clots. Regular health checkups. Talk to your doctor about your personal stroke risk. They may recommend medications or procedures such as carotid endarterectomy, cleaning plaque from carotid arteries, or stenting if you have significant blockages.
Stroke doesn't only happen to someone else. It can happen at a gas station, in your kitchen, or while you're enjoying your morning coffee, just like Barbara. And when blood can't reach your brain, every second means memories lost, skills erased, and parts of you slipping away. But here's the good news. Up to 80% of strokes are preventable. By doing just a few things: control your blood pressure and blood sugar, manage your cholesterol, stop smoking and limit alcohol, and most importantly, learn the early warning signs using the Be Fast method. Don't wait until a clot or burst artery changes your life forever. Take action today. It might be the reason you're still here tomorrow, holding the hand of someone you love. Share this video with someone you care about. And if you've ever experienced or witnessed a stroke, please share your story in the comments, because your voice could save someone else's life.